Neurodivergent patients make up a significant population of our cohort nowadays for healthcare providers in terms of the people that they treat. However, the way in which they process, consume, and really interpret information is very different to how or what you would see in the neurotypical crowd. And therefore, as healthcare providers, we need to alter and modify the way in which we communicate with them in order to achieve best outcomes for ourselves as well as them as patients. To learn how to do that, stay tuned for the rest of this video. Welcome back everyone to my channel. For those of you who don't know me, my name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps English as a second language learners and healthcare providers who work closely with patients improve their language and communication skills in order to build better relationships with their patients, as well as stand out in their workplace as a person of excellence. Now, one of my videos from a couple of weeks ago, you would have noticed I did cover quite a bit about how and why the awareness and understanding of neurodivergence or neurodiversity in our patient population is much more important now. To check out that video, I'm just going to leave the link over here. So do check that out for a bit of context on this one. So this really is part 2 of the video. We're now going to learn and look into some tips and tricks that we can incorporate in our daily communication if we are working with patients who are on the neurodiverse spectrum. Now, for some people, or some professions rather, in the healthcare space, where this is a common occurrence, where they are working with patients of this nature all the time, this might be a little bit of a second nature for them. So I'm here in this context referring to people like occupational therapists, I'm referring to psychiatrists, psychologists, or any form of speech pathologists, anything like that. So for them, this is something I'm a bit more familiar with. But as I said previously in that video, these patients, you can find them in any sort of area of healthcare. So they can be found in requiring healthcare services in any field, be it pathology, radiology, even like oncology, you name it. You know, there is obviously that awareness, that understanding needs to be there because they could be using your help and support as well. Now, how I came up with this video was, I have to acknowledge this, from this website called Don't Forget the Bubbles, and they have a little screenshot of how the communication framework really is when you are speaking or communicating with neurodivergent patients. And the acronym for it is Step It Up. So each of the words in the Step It Up actually represent one thing that we should be doing when we are working with and communicating with our neurodivergent patients. So I'm going to leave the screenshot over here, and I'm also going to leave a link to the entire article in the description box below. So let's get into it. So some of the things that we need to be aware of is that, as I mentioned previously, the way in which the people who are neurodivergent, their ways in which their brains are wired is very different to neurotypical. As a result of it, the way in which they actually absorb information, the way they try to make sense of it, the way they communicate and express themselves is very different to what you would find in the neurotypical population. And this really warrants the reason why we need to actually change the way in which we communicate with those patients, and also that way build a good relationship with them so that they can trust us and they get the support that they need from us. So we'll get into each of the steps over here in terms of the Step It Up, and I'm going to expand on as many of them as possible. You're obviously going to go back, and you can obviously go back and look at the entire screenshot as well as the article to know what exactly all the steps are. So let's get started. Before even going into that one, I wanted to just set the framework of some other things that are going beyond what the Step It Up process actually involves. So now, the first thing that all healthcare providers need to do is research and really analyze into what specific form of neurodivergence this particular patient is displaying. Because as we have mentioned previously, the spectrum for neurodivergence is a very broad one. So it's not just a linear one-size-fits-all, it's a spectrum. And I'm going to leave one of the examples of the spectrum of the neurodivergent spectrum over here, just in the screenshot above. So every patient's level of neurodiversity is going to be different. Every patient, the symptoms and the characteristics that they display is going to be completely different. So say, for example, a person or a patient who has Tourette's is going to be very different from a patient who has ADHD or autism or Asperger's. So every single person, every single patient operates differently, processes things differently, communicates differently, expresses things differently. And it also will be worth actually collaborating and working as a team with your colleagues in terms of getting a better understanding and educating yourself on what their specific type of neurodivergence condition is and how they need to be treated. So having someone who does this day in and out as an experienced first-hand person can really go a long way in helping you get a better understanding of what their condition is. Number 2, avoid bringing up their conditions unless you're specialized in working in that particular condition. So the point being, no one really likes to be labeled or excluded, and labels, unfortunately, these sort of conditions, they tend to do that. So when you're telling them that the treatment plan or strategy that you've devised for them has been made specifically for them, just leave it at that. Don't go the extra mile to mention because you have ADHD, because you have Asperger's, because you have Tourette's, because you have your neurospicing or whatever it's called. Yeah, so just don't mention that unless you are one of the professions who works in this field day in and out, like the therapists and the psychologists that I've mentioned about in the past. Number 3, keep your questions and information direct, simple, and to the point. And ask them in a language that they understand. People who are in the neurodivergent spectrum, they tend to take things very much at face value and literally. So you should completely avoid using things like metaphors, idioms, similes, because they will literally misinterpret that. So you can, for example, now this might be a very bad example because, it might come across as you're being a little bit dismissive to the client or patient, but I'll bring it up nevertheless. So you might say to them, looks like the cat's caught your dunk, right? So that's a very famous idiom. Now, obviously that doesn't mean people who are neurotypical, they will understand that, okay, that means that the person is just being silent and not saying anything. But in their heads, they will typically say, oh, it's because they will ask you, where is a cat? I don't see a cat that has a tongue that's sticking out or something like that. So they tend to take these things literally. So obviously do not ever say to your patient that the cat has caught its tongue because it's very insulting and dismissive. But for the purposes of the example, I just had to put that in there. That's number 1. Now, the very next thing is that these patients need to take their own time. So you have to slow down the way in which you conduct the sessions with them. Now, I am aware that all of us, all healthcare professionals, are really under the pump and we need to go through a lot of things in our day-to-day work, and our roles and professions are extremely intense, and we're also multitasking and keeping up admin work and things like that. However, the time that you really have with your patients is completely sacred, and that's why it's very important that regardless of who your patient is, even if you have a finite amount of time with them, you make the most of them. However, patients who are on the spectrum, who take a while to truly understand, comprehend, and process information, they need a little bit more guidance, understanding, and support. And that's why it's very important for you to take your time and navigate through consultations with them in a much more slow manner. Now, the next one, as I said, is you need to absolutely include the involvement, support, and presence of their carers, advocates, and anyone who is by them. Now, in this instance, I would also include support workers because they know their clients and patients really, really well. They're working with them on a daily basis. So they probably know a lot more about their clients and patients than probably you do as a healthcare provider. So it's very important, especially if you have clients who are nonverbal, who are quite disabled in many ways. They will have someone from their family or a support worker who can really be their voice, who can really be their advocate, someone who they can completely trust, almost like they're like a power of attorney. So that's very important that you involve whoever is the advocate or carer for these patients as regularly as possible. So that's quite very, very important. It's also very important to explain to enable compliance. Now, this sounds really complicated, but I will break it down in a much more simple manner. What I mean by that is provide a simple explanation of the steps of a treatment or a task and how it will benefit the patient. So what I mean by that is, say for example, you are an oncologist and one of your patients who is neurodivergent has been diagnosed with quite a severe form of cancer, and you are, say, recommending radiotherapy to the patient. So obviously in a lot of places now, radiotherapy comes in like a little machine. So you have to break it down for them step by step and say, this is the machine, this is what it does, this is how you use it, this is how you put on your body for this many hours in a day, this is how many times you take your medication. So even though it looks, a normal neurotypical person may be able to understand it, and yes, you have to provide all of this in writing for them. However, you have to take that extra effort or extra help and support when you are doing this for a neurodivergent patient, because, and this, as I said, this process completely enables consent, so they know exactly what they are going in for. This ties very well with transparency and honesty that I mentioned in all my previous videos. So that and you can also use demonstrations. So not just by providing visual clues, for example, you have to really think, be a little bit creative and think out of the box to actually provide them instructions that are supplemented or supported by visual cues, demonstrations, audio resources, video resources, whatever is going to benefit individually that patient with their particular condition. That is going to help them understand what they are doing. And also, as I said, get the carer or their advocate person on board as well. The next very important component definitely is that you need to allow your neurodiverse patients to touch and feel any kind of medication, any sort of support that they need. So if you go back to that example that we just talked about with patients who are undergoing cancer treatment, it's important that they actually get to touch and feel and understand what their device or their machine is doing. You can also use the same example for, say, a patient who is diabetic and they have to insert a glucose monitor in them. And you might be a gastroenterologist, and you might be performing a colonoscopy or something like that. And if you know that your patient is neurodivergent, you should be allowing them to sort of touch and feel the machine, within reason, so that they know what exactly this entails. Because that's one of the ways, they're very strong kinesthetic learners, a lot of neurodivergent people. And that's why having them, give them to experience touching and feeling whatever it is that they're coming across, can be a very, very good, can be a very beneficial thing for them. And it's the same process applies when you have radiology scans. So get them to touch the probe if they're having an ultrasound. Obviously for an MRI, it's a little bit more serious. So as much as possible and within reason. And it will just make them feel a little bit more comfortable. And also, things like when you are trying to some examples in which you have to touch your patients, and this is quite important when you're performing radiology scans or when you're performing some sort of an operation. You have to ask them, when you're say if you give even a simple thing like when you're giving them taking their blood pressure or taking their blood sample, you have to ask them, it's a good thing to ask them, would you like me to hold your hand firmly or gently? Let me know if this is too much pressure, or because they are also very sensitive to being touched, a lot of neurodivergent patients. So that way it can be very, very beneficial in order to do that. And the final point that I wanted to cover in order to make treating a neurodivergent patient and communicating with them a much better, a more positive experience for everybody would be make your environment during the consultation process a low stimulus one. Now, a lot of neurodivergent people are very easily triggered by things like noise, excessive light, excessive clutter. So it's very important and they will basically shut down. They will go to another form of room. They will start twitching. They might say some things that might be quite out of turn, that may be out of line. They might be quite vocal. They can become quite noisy and loud in telling the fact that they don't feel comfortable in that environment. So it's very important that they are in a room or in an environment which is quiet, which is not, so brightly lit, and also with the colors and everything that, very plain, simple colors that's not going to really reflect back at light on them. And especially if you're in a noisy environment, it's always beneficial to have noise cancelling headphones or earphones if they're comfortable with that. But as much as possible, what they will tend to do if they are feeling overstimulated, people who are neurodivergent, they tend to stim themselves. So stimming basically means that they are, they sort of take off, they go into an environment where they can sort of reduce the stimulus level to a homeostatic or a simple one so that they are able to function in that environment. And this can be done in many ways. So some of them will use stress toys, like little stress balls. Some of them can actually have plastic or silicone toys. They might actually play with like Play-Doh and things like that. All of these can be really good resources to have on hand if your patient you know is a neurodivergent one. So those are just some of the things that I have covered as much as possible in a very brief manner that you can really incorporate, quite simple things that you can incorporate in your practice when you are working with neurodivergent patients. So as I said, I have left a link to the entire list as a screenshot, and you can obviously have a look at the rest of the article as well. But I just wanted to give in my little 2 cents and things that you can do in the space of neurodivergence and how to communicate them best with them as patients. So hope you got value and some insight out of that, and it gave you some food for thought. If there is something that you never heard of before, or if you have any questions, please make sure that you leave them in the comment section below. That way the engagement can also really increase on my channel. And always, before you forget, please make sure that you hit the subscribe button and the notification bell in order to make sure that you are up to date on every video. And don't forget to like the video as well, to distribute it to the algorithms, and they know where to come for the people who need it. So thank you very much, as always, for your time, presence, attention, and support. Stay tuned for next week's video, which is going to be an interview with another expert in the healthcare field who's also a very good friend of mine. So stay tuned for that, and have a good week, and I will see you next week. Cheers.